Maraming salamat sa inyo lahat.
The term of Dr. Fidel R. Nimenzo as the University of the Philippines Diliman Chancellor started in March 2020, a few days before the Luzon-wide enhanced community quarantine was imposed. He immediately created a task force to guide the operations of the university during the COVID-19 pandemic. For the past 1.5 years, the UPD COVID-19 Task Force, composed of individuals from various fields of knowledge and sectors, has provided multidimensional perspectives to a complex public health problem. In developing its pandemic response, the task force recognizes the uniqueness of UP Diliman as a community. Hence, in making decisions, it considers not only its faculty, staff, and students, but also a population of about 56,000 residents from surrounding barangays. Its community-based pandemic response entails monitoring the emerging needs of its constituents, tapping the expertise available in the community, and building the capacity of the university to respond to the pandemic through self-learning, collaboration, and piloting. Community engagement has been one of the key strategies used by the task force in managing the challenges brought about by COVID-19 in the identified areas of health and safety, administrative services, academic and research activities, and effective communication. The efforts related to health and safety center on promoting wellness and preventing further transmission and managing suspect and confirmed COVID-19 cases. In maintaining good health and controlling the spread of the virus, both physical and mental well-being of the employees are taken into account. Specific health protocols like physical distancing and regular disinfection of offices are implemented. Mental health is also addressed through the help of the UP Diliman Psychosocial Services, which offers free counseling and psychotherapy services. Depending on the alert level classification declared by the national government, work from home and other alternative arrangements are implemented to maintain the unit's operations while ensuring adequate workspace for better ventilation. To aid in managing suspect and confirmed COVID-19 cases, the Public Health Unit of the UP Diliman Health Service supervises contact tracing efforts. UPD also set up 2 isolation facilities. Kanluang Palma, operated from April to June 2020, whereas Silungang Molave, which has already accommodated more than 750 people, opened in August 2020 and continues to operate at present. It also offers RT-PCR testing for individuals with symptoms or those who have been close contacts of confirmed positive patients. From May 2020 to September 2021, 9,135 RT-PCR tests were conducted here. To ensure the smooth flow of operations, despite the pandemic-related limitations, UPD determines the demand for critical services and provides adequate manpower for those. Staff members who are on work-from-home arrangement can continue their duties via the new communication infrastructure and systems developed. Even payments to employees, suppliers, and contractors can now be done online through government bank deposits. To make sure there is clear communication between the administration and the academic and administrative staff, UPD regularly releases memoranda that reflect the guidelines implemented by the national and local governments. As the flagship campus of the UP system, UPD is expected to lead the way in continuing the learning process amidst the pandemic through multimodal teaching. To support this, learning management systems and library resources were quickly put in place. For those students who do not have stable internet connection, printed course packs or USBs containing the course materials are delivered to them. Student Learning Assistance System was also created to guide students with the new learning platforms. For faculty members needing assistance with a new remote teaching setup, necessary gadgets, computer equipment, and internet connectivity were provided through a mix of subsidies, allowances, and interest-free computer loan packages. In terms of scholarly work, UP Diliman colleges and units partnered with other constituent universities and the Department of Science and Technology for creation and completion of timely research projects. Some of those led to the development of several biomedical devices. In recognition of the crucial role of communication, various channels are used to provide vital information to the UPD community. The task force, through the UP Diliman Information Office, provides updates on the COVID-19 situation in UPD and Barangay UP campus. Examples of these include weekly reports of COVID-19 cases and active COVID-19 cases area maps, which are posted on the UPD website and social media pages. The task force also formulates various sets of guidelines to maintain safety on campus and creates advisories to help the general public understand the evolving COVID-19 situation in the country. Webinars for units' health officers are also regularly conducted to train them on what to do when a staff member develops symptoms and how to conduct risk assessment. Lastly, UPD set up Bakunahan sa Diliman, not only to serve its constituents, but even the greater public. It is a volunteer-run vaccination site which mobilized about 400 volunteers. It also has partnerships with the United Nations Population Fund, WHO, DOH, CHR, and advocacy groups to vaccinate the homeless, survivors of gender-based violence, and other at-risk populations. From April to November 2021, Bakunahan sa Diliman administered approximately 32,000 vaccine doses. Because UPD's COVID-19 response framework may also be used for other types of crisis, the task force intends to come up with a book that contains UPD's experiences during this pandemic, which can be shared with other academic institutions and similar organizations. Nobody was ever prepared to handle the COVID-19 pandemic. Many institutions in the country continue to come up with the best approach to deal with this rapidly evolving public health situation. At the University of the Philippines, Diliman, our pandemic response framework is always anchored in honor, excellence, and compassion.